Hello, everyone. Good evening, everybody. I'm Priyanjali from Radiance with You YouTube channel. I'm sure all of you must be keeping good health. Today, we are talking about something that affects everyone, no matter where you live: fungal infections. We are going to have an important chat about them and how we can stop them from spreading by taking early action. Fungal infection like athlete's foot or nail fungus might not be the first thing when we think about it when it comes to our health, but they are important and they can cause serious problems if we ignore them. They can make us really sick if we don't deal with them properly. But don't worry, we are not just here to talk about the problem, we are here to talk about what we can do about it. We'll look into how to stop fungal infections from happening and talk about the latest treatments. This month is all about being aware of fungal infection and how to stay healthy. So let's connect today with our skin expert, Dr. Sweta Rambhia. Is a dermatologist and has an experience of 17 years in this field. Dr. Shweta practices at Just Care Dental and Skin Clinic at Malad, West Mumbai. She completed MBBS from KJ Somaiya Medical College and Research Center, Sion, Mumbai, and DDVL from Vydehi Institute of Medical Sciences and Research Center, Bangalore. And today we are honored to have her here on screen with us. Over to you, Doctor. A very, very warm welcome to you. Let's begin with the first question, which is what is this fungal infection that we're talking about?
So, hello and good afternoon to everybody, whoever is watching from whichever part of India. First of all, we should know of what is fungal infection and what we can do to prevent it. So, fungal infection is an infection which is caused by dermatophytes. That is a type of fungus. That is a strain of fungus which can affect. It can affect because of it can spread from person to person, or it can spread from soil to person, or it can spread from animals to human. That these are three modes of transport how we can get fungal infections. You mentioned about
Right,
athlete's foot.
right.
Basically, athlete's foot happens when like if there is a lot of sweating and if we keep our shoes and socks worn for multiple hours a day, and if we do a lot of physical activities like in sports persons, athlete foot is very common, and especially
Mm-hmm.
patients who have to wear socks the whole day and they sweat a lot. So athlete's foot is very, very common. It is actually known as tinea pedis because it's an infection of fungal infection of the feet. So athlete foot
Right,
is nothing but tinea pedis.
right. So now we are saying that fungal infection can have different causes, like fungal infection in different parts of our body can have different causes behind it. We are saying that, doctor.
Yes, so there will be the fungus is the same, but depending on the site which has been involved, the fungus will have different manifestation. Like there is a fungal infection, which you mentioned, athlete's foot is of the feet. It's known as tinea pedis. If there is a fungal infection in the scalp, it is called as tinea capitis. If there is fungal infection on the face, it is called tinea facial. There is fungal
Right.
infection in the beard area, which is known as tinea barbae. And also there is something known as jaw itch, which we commonly know, that is actually tinea cruris. And also on the
Okay.
body, if there is a fungal infection, it is tinea corporis. So depending on the site which is involved, the fungus can have different manifestation and different symptoms. The most common symptom
Right.
is itching and patches of fungal infection which we see, which we known as ringworm. That is what the patients
Right.
come and tell me that I have got ringworm.
Right. Right. So, doctor, just like we know that the fungus might be same, but the manifestation is different, as you mentioned. But tell us, is the treatment also different, or the treatment is almost the same, treating all these different kind of fungal
The
infections?
treatment varies from on the age of the patient, on the weight of the patient, and also if
Okay.
the patient has a lot of medications going on, then obviously the treatment will vary. Because if we have a small child, suppose I get a small child, a 1 month old baby with fungus, then I would generally treat the patient with only creams. If I get an adult patient, say 20-year-old, I would give the patient oral antifungal in addition to creams. And if I have a patient
Right.
who is 80-year-old who is on a lot of medications, then my medications usage will be limited. I will only be able to give very limited oral antifungal, but I will give them more of topical and other medicines.
Right. Now, Doctor, earlier you said that we are talking about fungal infection and how we can prevent it. But tell us, how do we prevent fungal infection in a situation where everybody is staying together, in a family situation per se? If somebody is already suffering from the infection in a family, what are the kind of preventions one could take in?
So my whenever one patient comes to me with fungal infection, I the instructions which I give them that you have to keep your clothes separate and you have to wash your clothes separate so that we don't reinfect other patients or other family members in our family who don't have the infection. So we have to wash our clothes separately. Whoever has the infection has to wash their clothes separately in a hot water cycle, and they have to have a shower twice a day, and they have to use the antifungal cream and the medication which I must have given them, and their clothes have to be separate. They have to be washed separately, they have to be ironed, and they have to be kept to dry in the sunlight. Those are specifications. Also the application method, I tell them that the affected area and the area around the borders have to be applied, the cream has to be applied there so that we can prevent spreading of the infection.
Right. Now, moving ahead, Doctor, there is another kind of fungal infection which happens on the nail, which is usually stubborn and takes a lot of time to get cured. So how does one deal with that? Also, another issue with fungal infection is the recurrence of fungal infection. So can you please also enlighten us about the same?
See, I always mention to all the patients that hygiene habits is something which we should be changing. I had patients, sometimes they don't wash their jeans very commonly. They feel that jeans can be worn 2 to 3 times before washing. And also, when we are in a hot and humid climate in India, mostly we do sweat a lot. So I tell the patients that if we can keep washing all the clothes which we are wearing after a single time you wear it, then we can prevent the reinfection from our own clothes. Because sometimes if we keep on re-wearing the clothes, we sweat and again we re-wearing them, then the chances of we getting infected becomes more. So that way we can prevent the reinfection from ourselves also. Second, we should not be sharing
Right.
clothes with friends, with family. We should be using
Hmm.
a new sort of clothes. Even if we have shared some clothes, we should be washing it and then re-wearing it. Third is all the areas, like if possible, all are even if we are wearing some threads in the lot of us wear chains and necklaces, and even sometimes fungal can occur because of re-wearing our earpods. That is a common side how fungus can recur. So we can clean them with alcohol, especially the earpods, and we can wash the threads, or we can remove it and re-wear new threads. If there are a lot of
Hmm.
people wearing threads like the ones for God, we sometimes don't wash those things, and the threads also contain multiple germs of the fungus, which by way we can reinfect. And also properly showing the dermatologist early as possible in the fungus symptoms. That's the best thing, because many times we show the doctor, and as soon as the fungus clears we stop the medications. We should let the
Right.
doctor decide when to stop the medications. The chances
Right.
of reinfection increases because we don't listen to the advice completely. We feel that okay, this 15 days whatever doctor has told us, that is enough, and once we see the lesions are cleared we stop going to the doctor, only for the fungus to
Right.
come back again, and then we have to go and show the doctor again. So we should be completing the treatment. The doctor should tell us when to stop the medications, when to stop the creams. These fungus these days are notorious. What we see earlier, we used to see fungus which were not so notorious, like how we see bacteria which are multiple, like which are say resistant to multiple antibiotics. Now we are seeing fungus which are not resistant, I say, but they need longer treatments of antifungals. So if we stop in between,
Right.
we can get reinfected. Also, in the weather we are, and sometimes we travel by trains, we use washrooms, we have to use other modes of transport, train, bus, everything. So if somebody is infected and we get affected or we get infected, we can always get reinfected also in the current scenario. So what I always tell the patient that you should be having a shower at least twice a day, and after the shower, make sure your body is dry completely. And especially if the patients are wearing socks for multiple hours, we should ask them to remove the socks for a while and re-wear the socks if they can remove in the office. Or if they can not do that, then they can keep multiple pairs of socks so that they don't get reinfected because of the socks. I'll give examples of
Right.
few patients. I
Now
think it's
we are
interesting
we
when
are
we
talking
go.
about a lot of
So I had a singer coming to me. He was a very old singer, but he thought that there was a particular underwear which was lucky for him. It might sound a little odd, but he used to wear it without washing it, and I felt that that is something which we should not ignore. Every single cloth which we wear should be washed and then worn. And many of these teenagers, they don't wash their jeans for multiple days because
your
jeans
questions.
are generally very thick
Right.
material, and when we don't wash the jeans, the germs keep on staying in the clothes, and then when we re-wear it, we get reinfected by them. Sometimes even if I've gone outside for half an hour, I will wear that pant and I'll maybe hang it and maybe re-wear it because I felt that I worn it for half an hour only. But if it is very sweaty and if we have sweat so much that we might get infected from the fungus, and if we re-wear those pants or those jeans, we get reinfected. So that is one of the reasons why we get reinfected. So hygiene is very, very important. Also, second thing is the temperature. Most of the times, I know patients they use Dettol and they say that I've cleaned the fungus because of Dettol. One thing you have to understand that Dettol is not an antifungal agent; it is an antibacterial agent, and it will not destroy the fungus from the clothes. What will help us destroy the fungus from the clothes is washing the clothes in hot water cycle of 60 degrees. That is the best thing which we can do. And a lot of patients tell me now that I'm using a washing machine. That's not practical for me to wash the clothes separately. So then I tell them that one thing you can do, you can soak your water in hot water, soak your clothes in hot water before washing it completely together in one cycle of the machine. That also is good enough for making sure that our germs in the clothes are getting vanished from the clothes when we are soaking the clothes in hot water cycle, and then we are putting along with the other clothes in the washing machine. So
Right.
that way we can prevent the reinfection. Also, when a lot of us have pets at home, so sometimes the pets also can give these infections to us. So we should be checking with the veterinarian doctors also. If our pets have got fungus, they have to be treated first. A lot of kids play with pets which are roadside. We can't do anything about the roadside pets, but I generally sometimes have to tell them that even if your kid plays with the roadside dog, you have to get the roadside dog treated with fungus. Otherwise, your kid will get reinfected every time the kid plays with the roadside dog. So we should also think
Right.
of our environment, our place we are staying, and also when we are using public toilets, we cannot sanitize everything, but that is something which can be the reason for spreading fungus. Second thing
Right.
is when we go to trial rooms for buying new clothes, we are
Hmm.
buying clothes that we don't know whether the previous person who has tried the clothes will have fungus, and there is no way to
Right.
make sure that that's going to be possible. So we should be very careful in. And also, when we buy new clothes, we should be putting them through a wash cycle and then we should be wearing them. That is something which will prevent the fungus.
Right, right. Now, uh, Doctor, we have spoken about a lot of things. You gave us a lot of information, but let's dive a little deep into it. Beginning with the nail fungal infection that we are talking about, we see women in our daily household mostly suffering from this, uh, possibly because they are mostly in contact with water, or you will see women since the day begins, they will start their water work and it ends by the night, which is mostly for all the household women. Now for them, doctor, there is a big confusion because they with time they start neglecting such symptoms. Tell us, how does the initial stage looks like if somebody is suffering from, particularly from nail fungal infections? How does the initial stage look like?
So, if the patient has a nail fungus infection, then the patient will develop white discoloration or sometimes yellow or green discoloration on the nail. You will see it develop on the nail. You will, when you look, the nails look shiny, and our normal nails don't have any discoloration on them. But when you see a patient with fungal infection, they will have some whitish discoloration. It starts with a whitish discoloration, and generally with time, it can increase in size.
Right, right.
And
Does
also,
hygiene
you
also
mentioned
plays a very,
about
yes, please,
you meant
please, doctor.
sorry.
You were saying something, yes, doctor.
I also, you mentioned about people who work with water, but even a lot of patients now are coming with who are going to the parlors with fungal infection. So we don't know if they are
Right,
also
right,
contributing, because what when we do any
right,
nail treatments in the parlors, we they break the cuticle, and that is one of the reasons why fungal infections also can come, because then they are breaking the barrier and they are making the nail more susceptible to fungal infection. So even
right,
parlor patients who spend a lot of times in the parlor do get fungal infection because of nail treatments also. Washing obviously
right.
is going to play a role. And also,
Mm-hmm.
a simple tip I tell patients who are a lot of washing the utensils, I tell them to wear hand gloves to use while washing the clothes or while washing the utensils. That will prevent the fungal infection. So the nails or the fingers also don't get wet. And I tell them, even if you have to wash a single cloth or a single utensil, you should be wearing the gloves and using it. That is the best way to prevent this from happening.
Right. Now, doctor, speaking of that, does hygiene also plays a very important role? And what if somebody have been suffering from this kind of fungal infection since a long time, and he or she has been negligent about it? Is it too late for the treatment at any point of time?
It is never too late. I always say whenever we decide to go for treatment, it is best to show in the early days, because if we show as early as possible, our treatment will get over in fewer days. But if we come late and if the infection is spread on the entire body, the treatment might continue for more days compared to patients who come for the first time. So it is going to be uh, the treatment will last slightly longer in patients who come later in for treatment, but it definitely is not, there's no right or wrong in this. We should take treatment as soon as we realize that this is a fungus. We should be taking treatment for it.
Right. Doctor, you also mentioned about animal lovers, people who are fond of animals, or stray animals, or who has pets at home. There is also a chance of the spread if you are always in contact with animals. So, what are the kind of preventions they can take in apart from apart from the hygiene part? What are the other steps they can take in? And is it equally important to treat both? The people, I mean the animal and the person at the same time?
Yes, so if you know that there is a particular stray animal has given me the infection, the animal has to be treated, obviously, because then if you go and pet the animal again in few days, you will keep getting the infection from the germs from the animal again if the animal is not treated. What we can do to prevent fungus is you can wear gloves while petting the animal also outside, and also you can wear full clothing so that no area of your skin is exposed. That is something which we can do to prevent ourselves. And obviously the stray animals have to be treated. It is very important to treat the stray as you treat a dog at home. So it's important to
Right.
treat them also, because those animals don't know that they have a fungus, and they don't know you. They just
Right.
come to you because they want some love and appreciation from you. They don't know they are
Mm-hmm.
causing the spread of the fungus. So we should be. It is our. If we know that this is a fungus, we should be taking them to the vet and taking treatment for them too.
Right. Right. Doctor, you also mentioned about public toilets earlier. Tell us, what about those people who needs to, use the toilet in their work situation on a daily basis? People who are office goers. What kind of prevention should they take in?
First thing, I would tell the patient that if you can carry like tissue papers, more tissue papers, you can keep the tissue paper on the seat, and then you can use them. So that will be a barrier. Also, there are alcohol sprays which are available. To some extent, that also sanitizes the areas, and you can use them.
Mm-hmm.
Third is we can avoid sitting on it. We can, if possible. So we can,
Right.
if there are Indian toilets available, you can be using the Indian toilets than the Western toilets. That's something which will help more.
Right.
The contact with the toilet becomes less.
Right. Doctor, now tell us, there is another situation where we see the spread of fungal infection nowadays, which is the gym. Uh, Mostly, we see a lot of people uh, having or getting fungal infection from the gym environment. The kind of prevention, it's very tough to keep on cleaning the equipments all the time, before you work out. There are a lot of people working out at the same time. So, how does one deal with it?
So gym again is a very good source of fungal infection, as you told me. But it is very imperative if the person ahead of you has, and the gym equipment also have to be clean with alcohol
Right,
before reusing them, and also if they can give a different sheet to every person who comes, so that that person will bring a new sheet and they can use that on the equipment, and then it can be used. So that is something
right,
which the gym owners should be doing, because a lot of these young people now go to the gym, and obviously because of sweating in the gym and using their washrooms and the shower rooms, and that's how you see an increase in fungal infection in a lot of young people now.
right. Along with that, doctor, can swimming pool, like using swimming pools, also somehow spread fungal infection?
Yes, definitely, because we don't know the number of people who have gone in the pool, and we don't know number of infected people who have gone in the pool. So obviously swimming pools do play a role in spreading fungal infections, and the pools have to be sanitized every day. Abroad there are rules, even the patients who are going to swimming pools, they have to sanitize every day. But in India, because of the
Mm,
scale of pools which we have, we don't sanitize every day. But ideal scenario, if you ask their guidelines, also the pools will have to be sanitized every day after a single time they have used it. But I think they don't do it every day. But ideally, they should be doing after every session of pool. It should be sanitized. The
right,
chlorine has to be increased, and the pools also, they have to check the levels of the bacteria and the fungus which is growing. I'm
right,
sure our authorities might not be looking at it, but if you see anywhere abroad, they have to look at the bacteriological count, they have to look at the fungal count, they have to culture that water to look for fungal colonies also. But India, I don't think many people are following the rules.
right. Now, uh, doctor, what are the kind of treatments that we opt for when generally anybody comes to us for with any sort of fungal infection? What is the general treatment that we offer?
if it is single patch and if the patient is a very small child, as I told you, I would just give antifungal creams initially. And if the patient is slightly grown, then I would give antifungal creams along with antifungal medications which are given orally. And that can be given for 3 to 4 weeks, depending on the type of lesion, depending on the site of lesion. And it has to given for longer periods if somebody has infection in the whole body. These days I've been seeing patients with extensive fungal infections, so our treatment can go up to 1 to 1.5 month also, and sometimes even beyond it we need to give.
Right, right. Now, doctor, because we are talking about medication, you earlier mentioned that over-the-counter medications can be really harmful when we are talking about fungal infection. Steroidal creams, it can be really harmful when we're talking about fungal infection, and mostly we tend to do that. We see a certain kind of scenario where one who suffers from the fungal infection, he or she visits the dermatologist, and the dermatologist suggests any sort of medicine, any the kind of medications that the person would need at that point of time. He or she would refer that, and as you earlier mentioned that the patient has a tendency of stopping the medication when they feel that they do not require it anymore, or the fungal infection has been healed or cured. But we see certain scenarios that after a point of time the infection again, it triggers again. So what the patient does at that point of time, he or she gets the earlier prescription, and they get the medication from the nearby chemist. Can this process, which is widely been seen in a lot of households, can this process be safe, or one should clearly avoid it?
So I always feel that if you get reinfected and if you feel it's a very small patch which you can easily use the old prescription, but I always feel it is best done under guidance. Like if you had a
Hmm.
problem in the computer, okay, if you have a problem in the mobile, we go to the mobile repair person and whatever he tells we obey. But here
Right.
you don't know that whether you are completely cured of the infection or no. You're not aware of the symptoms
Hmm.
or the signs. So I always feel it's best done in the hands of the experts. You should rely on the expert. You don't know whether the fungus has gone completely. You're just taking it, and maybe you've forgotten about taking it. I get patients who have used some other patient's prescription also, and they come to me and they say it's not going. See, every individual is different. I always feel that if suppose the fungal infection is very less and if it goes with the cream, you can actually take the cream. There is no harm in taking the cream if it's given by a dermatologist only. But if it is not going in 2 days or 3 days, you should be going to the doctor and telling them that okay, this has happened. It is my mistake that whatever last time you told me to come and show you again, but I couldn't come and show you, and I thought it had gone completely. But now let's come back again. See, another thing is sometimes the patient also goes and buys generic medicines. I had a patient, full family coming to me from
Hmm.
from small town in Gujarat, and they were all buying
Right.
antifungal medicines only. The same quality uh, of medicines was not made insured, but their fungus was not going completely despite taking the medicines. And I checked the name of the medications also. They were all right, but the raw material which the company was using was very inferior quality. So also the quality of the medications which we are taking does play a very big role.
Hmm.
This patient
Right.
had the fungal infection for 1 month, and after giving a good brand of medicines in 15 days, they came and thanked me. Although I did not play a very big role, I told them I just gave you good quality branded medicine which has made been effective. You was taking something which was of lower quality, and the same medication, only the brand was different, but it made a difference, and they came and told me thank you. So it's sometimes very simple that we feel that okay, we are taking some medications, it's not going, but sometimes there are other things we should be looking at. Maybe the drug is not effective, maybe the cream is not effective, so we should if possible, it is always better to show a dermatologist. If you were anywhere outside India, you would not get a dermatologist opinion so early, and you will have to pay lakhs of rupees. Fortunately,
Right.
you are in India, and you get the dermatologist access within the first day of getting the appointment. So
Right.
I think you should be
Absolutely.
going to the dermatologist as soon as possible and getting it treated as soon as possible, not delaying going to the chemist and speaking, because most of these chemists people give this over the counter steroid creams, and that actually makes the matter worse. Rather than helping the infection, it actually gives fungus more power to spread. So I
Right.
had seen a chemist person giving an antifungal cream with steroid in front of me, and I told him that it's a schedule H drug. You should not be giving to the patient, and he smiled at me. He knew I was a doctor. I told him it's not allowed for you to give the schedule H drug, and he smiled at me. And unfortunately, we are at the helm of the society where they just want to sell the medication, but we should always think, if the chemist, the same chemist person, if they have the problem, they come to us. So we should be smart
Mm.
enough to understand that we should not be falling to that trap, and we should be
Right.
consulting the dermatologist as soon as possible.
Right, right, absolutely. I think very rightly said, just because we are in India and we can get medications just stepping out of the home, or maybe nowadays we get medications, ordering at home, we get medications. We do not go outside also. Just because you can get it, people get it. Outside, you do not get medications without a proper consultation or without a
They
proper
don't even get
prescription.
paracetamol. They don't get only very few creams they will get outside the prescription. They
Right.
will not get any oral medications. So we
Nothing,
should,
nothing is
in fact,
available. Yes.
America people don't get antibiotics also. They stock them from India. So we should be thinking, yes.
Ex- ex-
It's
exactly
easier
my
to get
friends.
a
I
gun
have my
license.
friends.
Have you heard the name? It's easier to get a gun
Right.
license in America than getting an antibiotic. So we should be responsible to not spreading the fungus infection by going to a doctor and getting it treated, and not being be the cause of spreading the fungus.
Absolutely, totally agree. Well, with that, I think we can see few questions coming from the viewers, Doctor. Let's take those questions quickly. The first question comes from Adi Jain, who asks, "Hello, Doctor. Can nail extension cause fungal infection?"
Yes, so when these the Pala people do put nail extension, they actually put our hand we put our hand into UV, and also they use a gum. So sometimes during the application of the gum and during the process of using the UV, that causes the break in the nail cuticle, and the surface of the nail can get hampered, and that could be cause of nail fungus. And sometimes the equipment which they are using, if they have fungus, so obviously we'll be getting fungus through that.
Right. That was for you, Adi. The next question comes from Aditi Shrivastava, who asks, "Can we use neem on the fungal infection?"
Neem. Okay, so first thing, we are all obsessed with Ayurveda and neem. Okay, we don't know which breed of neem will help our fungal infection, and we don't know what neem we are getting available next to our house. So I don't have a very detailed view on neem helping in fungal infection on application, but there are reports of Ayurvedic people saying oral neem consumption help, but I don't know which type of neem will help the fungal infection. I would say that
Right.
you can increase your immunity with taking ashwagandha instead of taking neem. That is something which is known. We can increase our immunity with turmeric and ashwagandha and all those things which are known. So that way we can prevent the fungal infection. Then using any neem which we don't know how often it's going to be used, and how which actually type of neem is helpful in this infection.
Right. Now, moving ahead, doctor, tell us, does diet has any role to play when we are talking about fungal infection?
Actually, diet does not have any role in fungal infection per se, but
Mm.
we should be having healthy diet, not having junk food. That goes to any because our immunity becomes better if we are having a good regular healthy diet and balanced diet. That's something which our immunity depends on.
Right. Well, moving ahead towards the next question, which comes from Deepak Saxena, asks, can we reuse the cloth which we had worn during the fungal infection?
Yes, I told you can reuse, but it has to be washed after a single time you wear it. Every cloth which is on your body, even if you wear it during fungal infection, every day it has to be put in a hot water cycle. If that is done and you're re-wearing the clothes the next third day, then it's okay. It has to be washed, it has to be air dried in the sun, and it has to be ironed. Those three things are absolutely essential if we want the cloth to be free of fungal infection. So obviously you can re-wear the clothes. I'm not saying that you can buy new clothes, but you can wash them in hot water, soak them in the sun, and then iron them inside out, and then wear it.
Right. Well, doctor, slightly deviating from the topic, you being a doctor practicing since such a long time now, how do doctors maintain the kind of hygiene they should in the workspace if the patient is suffering from fungal infection? Or what would you like to suggest the doctors who are watching this live, the kind of the practices that one should take in?
So, as I think every doctor will tell you that a lot of practices we have to also do to prevent ourselves from fungal infection. We have a sitting job. So, whenever I get time, I also do yoga, meditation, everything else to keep my immunity on the higher rise. And also, I am into healthy eating. I am a Jain by profession, and I also, I mean, by religion, I'm a Jain. So I found the benefit of intermittent fasting, which the Jain sages have told 50 years ago. And I am a believer that we should keep ourselves clean and our surroundings clean. That way, we can prevent ourselves from any infection, and our immunity also stays high if we are doing the right things. We were taught in the school early to bed, early to rise, and that keeps us healthy, wealthy, and wise. Those things which we can follow, we should be following even now. And I think the ancient practices of yoga, meditation do help our immunity to a very great extent. We should be making use of our own privileges which we are born with being in India.
Right. Moving ahead, doctor, the next question comes from Gitika Sharma, who asks, does any specific shampoo cause the scalp fungal infection?
Scalp fungal infection is very, very common actually. Uh, Earlier it was not very common, but now it is very, very common. A lot of patients do get scalp infections because of pet animals, and also sometimes during kids in school can get reinfected from friends because they stay in close touch with their friends. So basically, it has to be treated as soon as possible, and it is very easy to treat scalp fungus if we take the treatment early in in uh, in the symptoms. We will see it go away very fast, and the scalp fungus is something which has not been resistant to treatment at all. Even now, I know the same drugs which used to work few years ago are still working in the scalp fungus. So as soon as you
Mm,
develop the symptoms, you should show the doctor. Usually, you will see patches of hair loss and scaling and itching. I had a patient few days ago who actually came with patches of hair loss, and the parents told me that this is alopecia areata or undri. But I told them
mm,
that he has itching, and it is not alopecia areata. It actually looked like fungus infection, which was because itching was more prominent, and the patch of hair loss was seen, and there was some scaling also. So he recovered completely because of right advice. So we should know. how to differentiate, and only a doctor will know how to differentiate between the two. So we should be showing the dermatologist as soon as possible.
Right. The next question, doctor, comes from Rahul Bastar. Asks, does plant can plant also cause fungal infection?
Yes. As I said, from the soil, very mushy areas. If you go to, we can get fungal infection from the soil. Because if it is very mushy and very you can see the algae and the fungus on the soil and on the water. If there is a water body which is not, even sometimes there are tanks, if we look at the overhead tanks also, they can also catch fungus, so we can get reinfected from these funguses. So we should be, if we go to a marshy area, we should not be going barefoot on these areas. That will be a sign to prevent the fungal infection.
Right. The next question and the last question, doctor, comes from Khan Danish. Asks, is it safe to use itraconazole for a long term?
It is right to use itraconazole only if a doctor tells you to use it, not by yourself. And it is better to show a dermatologist if you are on multiple medications. Then itraconazole might not be the right choice for you. Let the dermatologist decide whether it is safe or no. I think it is better to keep that decision with your dermat and don't take that decision yourself.
Well, Danish, that was for you. I believe this session was helpful for all the people who watched us live today. And the final thing which I would want to say is, do not self-medicate. Do not listen to the chemist. Do not listen to your neighbor or your family member, or do not use the medications that they are using. Please trust your nearest expert. And today we have Dr. Shweta here with us, our expert. Doctor, it was a wonderful discussion. Before we take a leave, any take home message for our viewers from your side who has watched us so far?
So I just give one take home message. The cream which you are applying, just check all the contents which you are using. Most of the patients are using something which contains steroid, and it should not be used for fungal infection. If we have, and we are sure we are suffering from fungal infection, we can only apply something which is a plain antifungal, and we should not be using over the counter steroid creams for treating the fungal
Mhm.
infection. We should be trusting our doctor and going to them and getting it treated rather than applying the steroid based creams. Thank you.
Well, that was the expert advice for today, and that was Dr. Shweta Rambhia for us. Thank you so much, Doctor, once again for your valuable time. It has been a very informative session for our viewers, and it was great to hear from you. We'll look forward to many more such sessions for our viewers in coming time. Also, thank you, viewers, for your excellent participation in today's session. For more updates, stay connected to our YouTube channel, and do not forget to subscribe to our YouTube channel. You all stay safe and stay healthy. Thank you.
Thank you. Thank you so much.